involved.
Well, actually, because during the summer, they spend half the time with their dad and half the time with me. So right now they're with dad, so I'm able to come here and do the show.
Oh,
and then when I get back in a couple of days, then they come and they're with me. And then when they go back with dad, then I go to New York and I do my touring, and I just try to kind of balance my schedule like that.
Perfect.
And,
well, thank you so much for joining us. Actually, both of you are
welcome.
going to be back after the break, and we'll be talking a little bit more about what's going on in terms of being a single mom with both of you. So the break's coming up, and we will be back with both lovely guests right after this.
If you or a loved one is experiencing depression, anxiety, or bipolar disorder, there is help locally. Bridgeway Psychiatric Center offers a day treatment program that combines medication management with psychotherapy to decrease symptoms and help clients get back to the things they enjoy. If these symptoms describe you or someone you know, Bridgeway can help. Bridgeway Psychiatric Center provides effective treatment without the confinement of a hospital. For more information or to schedule a confidential screening, call 562-0211.
At Memorial, we get that women are different and that you have special needs and wants, like modern birthing suites, the latest breast health diagnostics, advanced neonatal care, and other women-specific services. As a mother, daughter, sister, wife, and grandmother, you have many roles in life, and so should your health care. That's why there's Lake Charles Memorial Hospital for Women, a special place that understands your life. We are Memorial for Women.
Have you gone from being someone who was productive and happy, who enjoyed life and time spent with friends, to a person alone and confused? You can turn it around like others who have gotten help.
Have you or a loved one become addicted to pain pills or other opiates? If so, Behavioral Health Group's Lake Charles Substance Abuse Clinic can help. Please call 337-433-8281 to schedule a confidential appointment.
Welcome back. I'm here with Angelica Bridges and Dr. Leah Klungnes, and we are talking about single parenting. I want to talk to both of you now, and Dr. Leah, you're the expert on being a single parent. What questions or advice do you have for Angelica after you've heard her story?
I'm interested in how Angelica is handling parenting time, and particularly the transitions between one household and the other.
That's a very good question. It is not easy at all. And we've only been doing it for a short time since this is a very new situation.
Right.
So this summer has been very challenging because I'm potty training the 2-year-olds, which has been great, and it's so rewarding.
And your
but at
ex
the same
is
time,
potty training too?
Yes. So I have to make sure. Do you have the same potty that that has the singing little the Fisher
Tune,
Price?
right.
Yes.
Now, when the kids leave to stay with Dad, do they have to bring certain things with them, like their stuffed animals, things like that?
Absolutely.
They need those transitions. What do they need to feel good?
The blankets. They both have a blanket that they've had since they were born.
Okay.
And, it's a meltdown. It's a complete heart attack if those blankets are not in tow.
So they're okay going from mom to dad as long as the blanket is there. That's the blanket. Stability.
Yes. Right. And that's pretty much it. Sometimes there's certain dolls or toys,
Sure.
but it's the blanket is the main item.
And your ex is a professional athlete, so a hockey player. And
so he's on the road.
And the season's coming up.
Yes.
So what happens at that point?
Well, sorry, I know. They'll be with me 95% of the time from September until April.
Okay.
So actually, it does make it a little more stable, to tell you the truth.
Yeah.
When I have that time with them as much as I do, it's almost full time.
Right.
We get a good routine going. I'm dropping them off at school in the morning. I'm on the homework situation. It's at least with the 5-year-olds starting kindergarten, it's just a lot easier for me, I'd say, because it's consistency.
Now, Dr. Leah, I see this a lot, and I'm sure you deal with it a lot more than I do, but very common for two spouses when they break up not to communicate.
Absolutely.
And if they don't have kids, it's not that big of a deal. But when children are involved, what type of advice do you have for the parents out there when that's the case?
Start with the communication that you can handle. Just like Angelica is starting with email and speaking through her mom. Because the best interests of the kids are not served if there's no communication, whether it's basic parenting, things like toilet training, or as your children get older, it's going to be about things like friends, what you allow, what you don't allow, what the teacher had to say.
The rules of the parenting would be very important, because you don't want to have one really strict parent and the other one saying, oh, well, you can go out and do what you want. So, I mean, the communication, I think, is such a must, but I just really have a problem with the patients that I deal with along those lines, and a lot of times you just can't get them talking.
Well, they think that they're punishing the other person. You know, they're continuing whatever was the argument or the reason for breaking up, but the real victims then are the children.
Right. I agree, because unfortunately I had to cut off the communication because it was turning into harassment and, you know, very, very scary stuff. So I had to cut it off, and I feel bad because the children do suffer, and they're not getting that camaraderie between mom and dad being on the same team.
Does your 5-year-old communicate with his dad? Her dad?
She does, yes.
And how does she do that?
She really says it like it is. She's just very, very vocal and knows what she wants, and is a very good communicator on her feelings and emotions.
Does she call him up on the phone?
Yes, she does.
Wow.
Wow,
oh, yes.
That's fantastic.
She's 5 going on 13, so that's great.
Yeah,
that
5 going on 13.
Yeah.
That's always a good thing.
She'll be emailing before we know it, right?
Yes, I did get her an email address.
Angelica, any closing thoughts?
Yeah, like that was a great point. You know, you just work toward it. Each day is a new day. You just try to be positive and think about the kids. You know, that's the most important thing, is the children. You got to really not be selfish. Put your stuff aside and think about the project of raising these children to be amazing adults.
Right. I'm going to echo that. I think that is the #1 rule that I will tell every parent out there. If you go through a divorce, if you put your kids first, you will do fine. Couple that with open, honest communication with the children from both parents, and typically, even if you do have to go through a separation or divorce, the kids come out just fine. Q&As from my website. Stay tuned.
If you or a loved one is experiencing depression, anxiety, or bipolar disorder, there is help locally. Bridgeway Psychiatric Center offers a day treatment program that combines medication management with psychotherapy to decrease symptoms and help clients get back to the things they enjoy. If these symptoms describe you or someone you know, Bridgeway can help. Bridgeway Psychiatric Center provides effective treatment without the confinement of a hospital. For more information or to schedule a confidential screening, call 562-0211.
At Memorial, we get that women are different and that you have special needs and wants, like modern birthing suites, the latest breast health diagnostics, advanced neonatal care, and other women-specific services. As a mother, daughter, sister, wife, and grandmother, you have many roles in life, and so should your health care. That's why there's Lake Charles Memorial Hospital for Women, a special place that understands your life. We are Memorial for Women.
Have you gone from being someone who was productive and happy, who enjoyed life and time spent with friends, to a person alone and confused? You can turn it around like others who have gotten help.
Have you or a loved one become addicted to pain pills or other opiates? If so, Behavioral Health Group's Lake Charles Substance Abuse Clinic can help. Please call 337-433-8281 to schedule a confidential appointment.
Dear Dr. D, I have a 4-year-old son who is a very kind and loving boy. His father has been in and out of his life and has a history of drug use and abusive behavior with his girlfriends, including me. He signed his rights away 6 months ago, but I've offered to let him see my son, but he refuses unless he can spend the night. The problem is my son misses his dad. When he's cranky, gets in trouble, or gets upset, he will cry, "I miss my dad." And it breaks my heart to see him so sad. Am I doing the right thing? Lindsay. I'm going to throw this right over to you, Dr. Leah. This very sad email here. What
Very
do you?
sad.
Yeah.
She might want to reconsider spending the night with his dad if he does it somewhere where she feels comfortable that there's supervision.
I.e. grandparents' house, for example?
something like that.
Okay.
That's a possibility. If not, start somewhere where there is some supervision, like a family-friendly restaurant or something like that.
And then work forward. Angelica, what do you think?
Yeah, I think absolutely, you know, especially if he's crying for his father, he understands that's his father. There's a certain void right now that needs to be filled. He needs to see his dad. Yeah. And I would never not let my children, no matter what the circumstances with me and my ex-husband, they need to see their dad.
Okay.
And keep my position out of it because it's all